We all know people with pain. Pain costs a lot of money and have a huge impact on our life, our families' lives. And one of the big causes of pain is from our work life. More than 40 million European workers have musculoskeletal disorder because of their work. We had to do something about it. Pain costs more than 2% of the European GDP every year. We had to do something about it. This is people's life.
We've just had such a successful event here from Cycle Impact to Pain, really showing the power of our joint statement on mental health. Because while we have a comprehensive view from Europe on mental health, it's echoing the WHO's comprehensive plan that started 10 years ago in 2013. So really what we need to do now is ensure that for member states we're not waiting another 10 years for real world change for people that live with pain and or mental health conditions. So the time is now. We need policy, we need money, we need the effort to make the real world difference now.
It was a pleasure for me to be here today to address this and co-host this very important conference, which is bringing together patients, professionals, and also legislators, because ultimately pain and mental health are totally related, and that is why we need to continue to raise awareness, but also plan ahead. Now we are at a very crucial time in the European Parliament when we are dealing with the new mental health strategy being dealt with by the European Commission, and therefore it is of utmost importance that pain forms also an integral part of the strategy.
It was a very important day. It was a very important day for different reasons, to raise awareness on pain and mental health issues that co-occur often, but also that can be a problem increasing each other. Raising awareness on that for a better research, education, implementation, and informing policymakers.
Pain is a topic that is often neglected at EU level, and especially when you think of other illnesses.
These meetings are crucial to understand horizontally the knowledge that we have in our society and prosper in the future.
It was so important to be at the event today because it is essential that gender inequalities are addressed when it comes to neurology, but very specifically for pain, and that there is a reduction in the stigma and stereotyping of women when they approach the healthcare setting.
Coming from the ZIP event on mental health and pain in the European Parliament, and one aspect that I found interesting is one common problem that patients with pain or mental health, and even more so with a combination of the two, suffer from a stigma. That people don't really think what they have is a real condition, and that they're making things up potentially.
We've had a great discussion on chronic pain and mental health, and why chronic pain management is essential within any EU health strategy for mental health. The next steps will be the ongoing engagement we have with members of the European Parliament, with many amendments being submitted that are based on the joint statement of the societal impact of pain.